A urinary tract infection, UTI, is an infection that affects any part of the urinary system, which includes the kidneys, ureters, bladder, and urethra. Most UTIs are caused by bacteria, but some can be due to fungi or, rarely, viruses. They are more common in women but can also occur in men and children. Causes: bacteria. The most common cause of UTIs is Escherichia coli, E. coli, which is normally found in the intestines. These bacteria can travel from the rectum to the urethra and infect the urinary tract. Fungi such as Candida in rare cases. Other pathogens, viruses, or other less common bacteria. Types of UTIs. 1. Lower UTI. Involves the bladder and urethra. Cystitis. Infection of the bladder. Urethritis. Infection of the urethra. 2. Upper UTI. Affects the kidneys and ureters. Pyelonephritis, kidney infection, which can be more serious. Symptoms: lower UTIs, burning sensation during urination, frequent or intense urge to urinate, even with little urine output, cloudy, dark, or foul-smelling urine, pain or pressure in the lower abdomen or pelvic area. Upper UTIs, fever and chills, pain in the back, sides, or groin, nausea and vomiting. Symptoms of a lower UTI may also be present. Risk factors: being female, shorter urethra makes it easier for bacteria to travel to the bladder. Sexual activity. Use of certain types of birth control, such as diaphragms. Menopause due to hormonal changes. Urinary tract abnormalities, structural issues, or blockages. Catheter use. Suppressed immune system, e.g., due to diabetes or other health conditions. Diagnosis: urine sample checked for the presence of bacteria, white blood cells, or red blood cells. Urine culture determines the specific type of bacteria causing the infection. Imaging tests for recurrent or complicated UTIs. Imaging, e.g., ultrasound, CT scan might be needed to identify abnormalities. Cystoscopy, in some cases, to examine the bladder and urethra. Treatment: 1. Antibiotics. Prescribed based on the type of bacteria and severity of the infection. Common antibiotics: trimethoprim sulfamethoxazole, TMPSMX, nitrofurantoin, fosfomycin, ciprofloxacin, or amoxicillin clavulanate. 2. Pain relief. Over-the-counter medications like ibuprofen, phenazopyridine can help relieve urinary discomfort. 3. Hydration. Drinking plenty of water to flush out the bacteria. Prevention. Drink plenty of fluids, especially water. Urinate after sexual activity. Wipe from front to back to avoid spreading bacteria from the rectum to the urethra. Avoid holding urine for long periods. Wear loose-fitting clothing and cotton underwear to keep the area dry. Avoid irritating feminine products, e.g., douches, powders. If untreated, UTIs can lead to complications, including kidney damage or sepsis, a life-threatening infection. It's important to seek medical care if you suspect a UTI, especially if symptoms are severe or recurrent.